Ever wondered why your hands and fingers feel numb after a long day of typing or texting? This could be a sign of carpal tunnel syndrome, a common condition that triggers pain, numbness, and a tingling sensation in your hand and arm. It results from the compression of the median nerve, one of the major nerves to the hand, as it travels through your wrist. This nerve compression can be triggered by repetitive motions, such as typing or any wrist movement you do repeatedly. Think about it. How many times a day do you use your wrists in a similar motion? It might be more than you'd think, and each time, you're potentially exerting pressure on that vital median nerve. This information is not meant to alarm you, but to raise awareness about this quite common condition. So, how can we alleviate the symptoms of carpal tunnel syndrome at home? Let's delve into that next. Can you believe that simple lifestyle changes and home remedies can significantly ease the symptoms of carpal tunnel syndrome? That's right, and this isn't just hearsay, it's supported by numerous studies. So, let's dive right into it. Firstly, taking frequent breaks is an easy way to help manage this condition. If you're involved in tasks that require repetitive hand and wrist movements, make sure to rest your hands every now and then. It's like giving your hands a mini vacation during a hectic workday. Next, try to avoid activities that worsen your symptoms. If certain movements or tasks cause discomfort, it's best to steer clear of them when possible. And no, this isn't a free pass to avoid doing dishes or typing up that report. It's about making mindful choices to prevent exacerbating your symptoms. Now let's talk about inflammation. When your wrist is inflamed, it can be extremely uncomfortable. A simple remedy is to apply cold packs to the area. This can help reduce swelling and provide some much-needed relief. It's like treating your wrist to a cool, soothing spa session. Remember though, these remedies can help manage the symptoms, but they're not a magic bullet. They don't treat the underlying cause of carpal tunnel syndrome. This is a point that was reinforced in a 2020 study published in PubMed titled Home Remedies, Carpal Tunnel Syndrome. The authors of the study emphasized that while home remedies can provide temporary relief, they're not a comprehensive solution to the problem. So what does this mean for you? It's simple. These remedies are a great way to manage your symptoms and make your day-to-day life more comfortable. But it's equally important to understand that they're just one piece of the puzzle. While these remedies can help, it's important to remember that they're not a cure-all. If symptoms persist, it's crucial to seek medical advice. Don't hesitate to reach out to a healthcare professional if you're struggling with persistent discomfort. After all, your health is your wealth, and it deserves the best care possible. But wouldn't it be great if we could avoid carpal tunnel syndrome altogether? Of course it would. And the good news is, we can, to a large extent. Maintaining a healthy lifestyle is key. Regular exercise, for instance, can help keep your muscles strong and flexible, reducing the likelihood of nerve compression. Proper hand and wrist posture is another critical factor. Avoid bending your wrist all the way up or down, and try to keep it relaxed and in a neutral position whenever possible. This can help minimize the strain on your carpal tunnel. Lastly, and perhaps most importantly, avoid repetitive strain. If your work or hobbies involve repetitive hand or wrist movements, take regular breaks and, if possible, switch hands. This simple trick can go a long way in preventing carpal tunnel syndrome. Remember, it's always easier to prevent a condition than to treat it. So take care of your hands and wrists, and they'll take care of you.